But let's talk about, because a lot of parents will be thinking about fluoride. I think this is something that we've had at least 5 dental practitioners on the show. We've had cardiologists on the show speaking about a lot of these topics, and we'll put the links to the show notes. But let's talk about these areas like the osteonecrotic areas, the role of fluoride, the role of periodontitis, and inflammation in the body generally.
So, I mean, fluoride is one of those that for me is very frustrating, that, we know it doesn't have an impact on, or a positive impact on the body. We know that. All the research shows that. We know that it doesn't per se stop decay. So to put it in, so it's great if you're going to use it in your toothpaste. If you want to use it, that's fine. If your child can really rinse well, get rid of it, fine, use it. If you're obsessed with it, I'm not a massive fan. But the problem is putting it into our drinking water, which we have. All our water in South Africa has got fluoride in it. And the problem with that is, as with any drug, you're not measuring it out according to the person's weight, according to their age, like you would do with any drug. If you're given a script, well, we take into account what is your age, what is your weight, what are we trying to achieve with it? Whereas you put a drug, and this is, please get me straight on this is a drug or a chemical. Maybe it's even better, chemical that we're putting into our water. It's not there to clean our water. It's not there to do anything except supposedly decrease decay in third world countries. And it doesn't do that, because it goes into the body. It doesn't have a homing device for your teeth and go, okay, well, cool, I'm going to just move to the teeth and make sure they're super strong. It pretty much goes across the body, and in particular the pineal gland in the brain, which for me is massive. I mean, we want to be sharp. We want to be lateral thinking. We want our kids to have the best. And in this world, if you can't lateral think, if you can't think out of the box, if you can't use your basic intuitiveness, then you're in trouble.
Yeah.
And for me, without sounding like a conspiracy theorist, I mean, it's a crime to put fluoride in water.
Okay.
So
and what does that fluoride in toothpaste do to the oral microbiome? Because I think that's very, very important in looking at the pellicle, and knowing the pellicle is so important. As this transparent neck that goes over the teeth is something that we've done in our families. We don't use fluoride at all. We're quite specific about that. What are your thoughts about that?
100% agree. I think, a lot of parents will ask me, they say the pediatrician said, the child's mouth's going to be a mess because they're not using a toothpaste with fluoride. On the contrary, it really isn't about fluoride or about toothpaste. It's all about brushing technique. It's as simple as that. You've got to get in there and brush. And for me, the best toothpaste is probably just to take coconut oil, flavor it with an essential oil that your child will like the smell of, or you'll like the smell of. At the end of the day, it's a very personal taste. If you want a little bit of grittiness, put some bicarb in, whatever it is, and just use that as a basic, and you're not killing anything off. If your child swallows it, there's no negative to that. So for me, that makes, sorry, I'm bumping on my computers here. It makes a lot more sense to just keep it as natural as possible. I mean, we live in a toxic world where there's so much, from already within the room, our babies are bombarded with so many chemicals. So I don't see the logic on adding to that, especially if your baby is bottle fed. You're looking at your average baby drinking 5, 6, 7, 8 bottles of formula that's been mixed with tap water. And you kind of go, gosh, how much fluoride has this tiny little body taken in? And that's where I'll start becoming really concerned, about the way forward.